Uh, Sorry for a delay. We are live now.
Okay.
Okay.
So good afternoon, everyone, and a warm welcome to you all. I am Elisa Morris, a junior psychological counselor at Symbiosis Center for Emotional Wellbeing. And today, on the 4th of September, we observe the World Sexual Health Day. And the theme for this year's World Sexual Health Day is positive relationship. So to understand the significance of fostering positive relationship, today with us we have Dr. Rahul Bagle. He is a psychiatrist and the deputy head at SCEW. He is a certified REBT practitioner, and mind body science, de-addiction, and sexual medicine are his. We also have Ms. Devashri Kaple. She is a psychological counselor at SCEW. She holds a master's degree in clinical psychology from Manipal Academy of Higher Education and a postgraduate diploma in school psychology. She is a client-centered therapist and has working experience in the fields of education and mental health care. So thank you, Dr. Rahul and Devashri, for joining us today.
Thank you for the kind introduction, Elisa. And I think we should start with the webinar because audiences are waiting and hopefully few more people will join.
Yes. So, as we observe World Sexual Health Day today, I'm sure that all of our audience who has joined here are more curious about why this day is being observed.
Yeah. Devashi would like to share something on this.
Sure, sir. A warm welcome to all our audiences, and thank you, Alyssa, for the lovely introduction. 4th September, all around the world, is annually celebrated as World Sexual Health Day. The World Association for Sexual Health recognizes 4th September as World Sexual Health Day. Right now, what's the need for a special day dedicated to sexual health? So we all recognize that sexuality, sexual health is an integral part of the human experience at large, right? The transition into adulthood, that brings a lot of change in our thinking, feeling, behavior, right? Sexual function is considered to be an important part of adult functioning. Therefore, it's very important to talk about sexual health at large, the challenges that come with it, and how do we navigate those challenges and the importance of it all.
Yeah, absolutely, Devashi. Also, we see that there are quite a lot myths or taboo related to this topic, which prevents a healthy discussion or sharing the concerns. Or see, even the terminologies people are not clear about, and that deters them, or their vocabulary deters them from asking the doubts. As a doctor or as a sex therapist, when we see clients in the clinics or reaching out to us, they might feel fearful that can I use this term, or can this would be the right word to ask my question, or how to frame these kind of doubts with someone. And the days World Sexual Health Day are key importance that people get to the awareness to these webinars or open house or discussions or roundtables and various workshops. Also, we as Symbiosis Center for Emotional Wellbeing used to conduct certain workshops or certain awareness sessions on sexual well-being also. Now, which is a part of health and wellness module for the Symbiosis International University students, yeah, undergraduate and postgraduate. This is a great opportunity to discuss on the theme, Elisa, and we are eager to listen the theme and discuss upon it for now. Yeah.
Right. And I think as you mentioned that there's so much taboo regarding sexual health that it becomes difficult to just, bring about that topic. And this year, as we are observing World Sexual Health Day, the theme being positive relationship. I was wondering about how positive relationship would be related to sexual health and how can it be fostered?
Yes. So, see, when people think about sexual health or sexual expression, uh, they might be confining their thoughts related to the genitals and the sexual health or hygiene or some kind of a or sexual activities. But what people mostly ignore is the form of attachment or a relationship they form with their partners. And it is mostly a prime kind of a foundation based upon which the sexual intimacy or the sexual connection or the sexual activity will be there, because how the relationship is getting frame that will determine how the sexual intimacy will be perceived from the partners. And we don't want to just restrict it to the sexual part, as we see the World Association for Sexual Health that they are mentioning this time. They don't want to restrict this year's theme just for the sexual connotations, and they are focusing on the relationships as an integral part of human well-being or the community's well-being. And part of relationship, like in most of our communities, we see relationships are taken into the aspect of either romantic or sexual relationships. But relationships are something where we connect to any human being on this planet. That is a kind of a relation we had with them. It could be like when the children grow up, they develop some kind of a friend circle. When they go to college, they may have certain peers around them. When they are in the family members or family meetings, they will be having some family members alongside them. So this is all what different relations people harbor into their life. But a few relationships which are important with regard to the sexual expression, and so that is something we are trying to focus through this webinar today. Yeah, Devesh, you have something else to share on why positive relationship? Because relationships have been recently also we have seen that there are certain aspects that make the relationship troublesome, or some kind of a news people read and that they understand that relationship is something. Many times parents may feel that this is not something good for my child or my adolescent or kid or my young child should have, in the young adulthood, what specifically. So, bringing about what are the attributes of relationship which are healthy, which make each other respectful and into the part of this journey on a self-fulfilling journey through life. That is what we want to highlight. Yes, Devesh, you want to add something, please?
Sure, sir. I agree with you. We often think when we think of relationships, we have all of us have shared different kinds of relationships with our parents, with our children, with our partners. Typically, again, in this context, when we talk about relationships, what crosses our minds is a married couple, right? But we also have a romantic relationship. Sexual relationships do exist. Again, when it talking about relationships, we often think about heterosexual couples, right? But we also have homosexual couples, right? So all kinds of different kinds of relationships do exist, as you said. Now, why do we talk about positive relationships on World's Health Sexual Day, right? So relationships again are a very cornerstone of your life experience, correct, at large. Within that, as we spoke, sexual health is very integral to our overall well-being. um, so therefore, it's very important to talk about how can we create a healthy relationship with someone, with your partner in this context, and how can we maintain a healthy relationship. When we talk about two people have differences in thoughts, feelings, opinions, likes, dislikes, preferences, desires, and expectations also, right? Therefore, it's really something that we have to pay attention to and learn how can we really create a positive relationship with my partner. That's part one. And how do I maintain a positive relationship with my partner? So it's very important
Yeah.
to shed light on these
So
issues.
learning the rules is equally important, what I see in the part of this relationship journey. Because
Right.
if people are not aware and they're just following on based on some kind of role models if they have, or some kind of a media impact, and they're just following based on those ideologies, then it is only going to cause them harm, because they are not aware about how they can nurture relationship to its true extent, and
Hmm.
how that can be part of a mutually kind of a benefiting or mutually kind of a progressive kind of a thing for the partners during in this relationship journey, right?
Yes, sir.
Right. So it's very clear that, focusing on our positive connections within our relationship is really important. And, when we talk about relationship, I think the first thing that comes up to my mind is how communication is very important for a good relationship to, function. But, there are often so many barriers about talking about anything related to sexuality or, intercourse. Why do you think it's so difficult for people to communicate about sexual health?
Yeah. So what I see, before we reach to the sexuality or sexual expression or sexual activity related communication, there are issues related to communication in relationships also. Like what people are feeling, they may not be able to express it because of some concerns like lack of emotional awareness, or they are not able to identify what are the actual cues what they are assuming based on any relationship. And this kind of assumptions made, or this kind of inferences made based on their previous attachment patterns or their own inferences which impact the relationship first. So the role of communication is at first and by large important into a relationship, and then it will get translated into the sexual aspect for sure if it is worked on the relationship. That I would like to say first. And yeah, Devesh, you want to add something with regard to relationships or the sexual activities also, the what way the communication can be helpful for people to nurture?
Yes, sir. Thank you for sharing that. I'm really glad you mentioned that fostering a good, healthy relationship, first of all, is important in order to then have a pleasurable, healthy sexual relationship with your partner. I agree with you. Communication is definitely a cornerstone. An important component of communication, when we talk about communication, is just having open, honest communication, right? That often, again, when we talk about communication, it's not just again talking about what you like, what you dislike, what do you prefer. It's also about listening to other person's expectations and desires, right? So I think it really starts by understanding, first of all, what do I like, what do I not like, what am I open to, what am I open to exploring, right? As Elisa, thank you for pointing out that these issues around sexuality and sex at large, these are some very difficult topics for people to think about, talk openly about, right? So therefore I think it really begins, one can begin by understanding their own relationship with these concepts at large, and that therefore when we talk about communicating that with a partner, it really helps, first of all, understanding what are your thoughts and feelings and desires regarding it. Then it's really important to communicate that with your partner in an effective manner, right? Being very clear about it. Consent is an important component of communication. It's very important to be honest and open. Uh, Another very important component of a good communication between a healthy relationship is having respect, right? As I mentioned initially, that we all are very unique individuals, right? We all have our unique experiences in life. Therefore, we all have our unique thoughts, feelings, behaviors, desires. It's important to understand that your partner can have different likes and dislikes. Therefore, it's important to also be respectful during the communication process. And as I said, also actively listen to other person's thoughts.
Yeah. Developing certain values while this journey of relationship is been going on, like developing a mutual trust on each other while going through different challenges, and respecting each other through various kind of challenges in this journey of relationship is also something what people develop eventually. So the relationship journey is itself mean to develop that kind of a values where trust, mutual safety, respect, and a kind of empathy, kindness develops toward the partner. And that is how the sexual communication can also be done through that way. And that will give rise to a certain kind of autonomy over that individual, that they can keep into account other person or their partner's expectation, or uh, their kind of ideas into account before they are communicating with them. And I remember an interesting experience when I was working as a psychiatrist in my during my training, that people have issues with communication with doctors. So it is not just with their uh, partners they are struggling with the communication. So some people, when they have to communicate to the doctors what problem they are facing, they have issues how to communicate this kind of a problem. So there was a patient who was in our OPD, and I remember that I was not able to get what this patient is trying to say. The patient was going to ask me that come close, I will try to tell you very softly and very privately. So the patient, he was trying to say, he was a male, middle-aged male, that 6:30 का 11:30 नहीं होता. So that was his complaint. And I being the very new resident that time, that I was not aware what he is trying to say, whether his reality is impaired or his communication is something a barrier, and was not able to express it. So that is how I reached to one of my senior, and then he suggested these are the kind of terms that they have designed by themselves based on their own understanding about sexual ideas or sexual expectations or the sexual phenomenon. And that is how we need to know. We need to ask them very clearly as a mental health professional or sex therapist also, what was something that you were going through when you had this kind of experience? What are you trying to say? Are you going to experience or sharing about your physical experience or something related to your emotions or something on a social or legal or some other experiences you are trying to share? So that is something we need to ask on each and every point, because every kind of experience will have a different cross section with various domains also, and that is how we need to check with the clients also. This is for mental health professionals we want to share, or the sex therapist, that they can touch upon what the client is trying to bring and what situation they are trying to describe, and that kind of a comfort we need to develop. And this is equally important with the relationship partner. Once there is a comfort developed and we know that we can share this without being judged, or our opinion is going to be acknowledged, maybe it will not be accepted but acknowledged or thought upon. So it is a mutual trust that develops, that relationship partners can exchange their ideas, their fantasies or their expectations and desires more comfortably, and they can come to a common kind of understanding that which way they would like to explore this sexual activity. Yeah, Felisa.
Right. So, as you mentioned, since healthy communication is a very important part of any relationship. So, going from that, how can a healthy communication can it be the precursor of emotional intimacy in a relationship? And how could that affect sexual health as well?
Yes, so yeah, Devashi, you want to answer this?
I'm sorry, Elisa, can you repeat your question? I think I lost that.
Connection. Yes. So, as you mentioned that healthy communication is very important, and I was just wondering if it is the precursor of, emotional intimacy, and how does it play out when we think about sexual health included in it as well?
Just to check, you asked how does healthy communication take place in a sexual relationship?
Yeah, so if may I
Yes,
jump
sir.
into this,
Yes, sir.
Devashi? Yeah.
Yeah.
So see, as we discussed initially also, that relationship is something is going to be a foundation, that how the person is feeling trusted, how the person is feeling being respectful in that journey or in that kind of a companionship. And this forms, because see, our human brain is not just going to see what people assume primarily, that these are the hormones which play into action sexual expressions, but we cannot ignore that there is a human brain which has emotional apparatus, and that also gives a important aspect of the sexual feelings. So the feeling sexual expressions cannot be just restricted to the hormones what the person is experiencing, but it is fueled by the emotion that the person is feeling for that individual or their relationship partner. And once there is a safety, once there is a mutual respect, once there is a trust established, it becomes a very strong kind of a attachment pattern in the emotional apparatus or the limbic apparatus of that person. And there is a kind of emotional intimacy where they can share each and every emotional experiences they are having, and that gives rise to a cohesive kind of experience, that what many times you might be seeing that in the movies or something, they don't distinguish that this person is something different for me, but just I am into kind of this person, or I am just like this person. So that kind of intimacy they start feeling, because they could share each and every part with them without being judged, and they feel that uh, I won't be liking to hide, because I am going to be trusted, or I am going to be accepted the way I am sharing my details. So that is intimacy built on the positive aspects of the relationship. Yeah, this is it.
Okay. So just to get an understanding of where our audience is at also, so we also have a poll going in. So can Sir present that poll to our audience?
So SIU IT team maybe Yeah, so thank you for sharing. So there is a myth buster for our audiences, and
So we can all
sex,
vote based
yeah,
on what we think would be the right answer.
yeah, if may I read it out, the sex education should not be started for children until they reach their 18 years of age. Yes, no, can't say. I would request all the participants to uh, uh, answer it. Is it possible to answer for you, Devashri and Eliza, or is it in?
Sir, I'm able to see the question and the
Yeah,
options, but I'm unable to respond.
yes. So we can check with SIU IT team how can go to the polls and click on the polls. What is I would suggest now? There is a tab polls, but SIU IT team, can you please help us? We are not able to. Yeah. So now it is after clicking the polls, I think we can get the options. So if you can press whatever you feel, anyone response. Sex education should not be started for children until they reach their 18 years. Yes, no, can't say.
So just one thing for those who are maybe unable to answer, you have to click on the question. Once you do that, the options will be activated. Then you can see yes, no, and can't say. Then I think everybody will be able to respond.
Yeah, so has everybody been able to respond it so we can see anonymously what are the reactions? How many responses we have got this IUIT team?
Sir, we got three responses and all three are no.
All three or no. So great, we have. Thank you for sharing this responses, this IUIT team. So many times people have this myth also that sexual information is something to be shared after certain age, like they are going into mature adulthood. But it is something we need to understand that every individual is born with certain organs which determine their biological sex. Upon their adolescent and early adulthood, they could explore what is their sexual inclination or what is their sexual sexual individuality, what they develop from it. And that doesn't mean that it needs some time, because we see that a good touch, bad touch, these are equally important to be shared to the children in school age, because that will only prevent certain kind of unforeseen incidences or some kind of unfortunate incidences in our communities. Once every child is aware about what way they can have anybody around them who is touching them, and what way this touch can be a good touch or a healthy kind of a touch for the children also. So it is equally important that sex education should be part of early development, starting from the school and starting from their understanding at that level. I think many schools have incorporating this to their thing, their teachings, and based on the school age children. And so, yeah, you can move ahead to the next part, Eliza, after this poll.
Right. So thank you everybody for answering to the poll. So, when it comes to relationship or sexual relationships, consent is often discussed alongside pleasure. It's even interesting to see how deeply intertwined these two topics can be. So, Devashri, how do we define consent, and how important do you think it is in a healthy sexual relationship?
Yes, thank you for asking that question, Elisa. It's very important we all revisit the concept of consent. So, consent refers to agreeing. Again, when we're talking about consent in sexual relationships, it refers to agreeing to engage in a sexual activity. Right now, again, when we think about a sexual activity, what immediately crosses our mind is penetrative sex, intercourse, coitus, right? But it's important to note that when we talk about sexual relationships, there are a range of sexual activities that exist. Therefore, it is important to take into account that it's important to ask for consent, right? And it's important to give consent also. So it's nothing but agreeing to engage in a sexual activity. It can range from intimate touching, kissing, to actually engaging in other sexual activities also, right? So an important part of, again, consent, what crosses my mind is that it is open, it is very clear. Consent giving, consent taking is not a confusing process, right? It's a very clear yes and a very clear no, right? So it's important to take permission and check with the other person, because sexual activities or intimate practices in general, they're highly personal, highly private, they're highly intimate, right? It's a very personal human experience. Therefore, it is of utmost importance to check with the other person and check with yourself also, right? Am I ready? Do I really want to do this? And again, as I said, it can be applied to a variety of sexual and intimate activities. So yes, very important to ask for consent and to give consent, definitely. Again, I should mention this, that as I said, consent is a very explicit process, and it's a very ongoing process. Now, there's a reason I'm calling it a process, right? So let's say you agree to engage in some sort of a sexual activity. Due to some reason, moving ahead, you feel uncomfortable by something or someone. That individual has the complete right, then, therefore, to just say no, right? I'm not feeling comfortable right now, I don't want to further engage in this. It's important for as sir rightly mentioned, sex education should be taught during your school going ages as well, right? So it's very important to understand that every individual has that sense of autonomy, that right, that I can agree to something and I can disagree to something. Therefore, it's an ongoing, explicit, a very clear process of communication. Yes.
Yes, yes, and resonate what you are saying, Devashri. And what we see that as there is a issue related to communication, and what people observe through, see if the sex education is not provided through proper resources or proper kind of a educational material or through resource persons, people are trying to get it from some means which are not the right ones or which are not the appropriate ones. And that is what we usually see, that people assume based on certain kind of pornographic material or something what they see, and their idea of consent may be not established, or they may not be clear with that. Was what even during in movie scenes or something, if you see that there is any kind of intimacy been depicted or recorded, so there will no communication, like it is just a kind of a mutual kind of a just an eye contact and something they will try to share. It may be for the purpose of the movie scene or something that they are trying to crisp it, but while working on the real life scenarios, it is important that you check on your partner through verbally and through their non-verbal gestures, whether they are comfortable with what you are trying to ask them. And if there is a strong no, there is no right or wrong about saying no. So no is a no, and there is no question can be asked about why no or what no, because that is something that each individual needs to know before they develop into their physical maturity, that they are aware that no is just a complete sentence, and there is no point asking why to say no or why it would have been no. And that should not give rise to any kind of understanding that whether there was discomfort, there was a not a wish or something, because no is itself a sentence what we assume and what we adhere to. So that is clearly been understood by our youth generation, that consent is a, in a simple term, we call this as a prize, as a mnemonic. So it is freely given, that there is no coercion or no kind of domination to any means, like physical or some kind of intoxication with substance, or any kind of manipulation, say for monetary purposes or so. So there is a freely given kind of a consent. Then R is reversible, as Devashri right said, that at any point, any moment, the person into this act can take this consent back and say no for the activity what they are previously thought that it may be interesting or they would like to opt for. It will there is a informed. Third is the informed, the freely given, reversible, and informed. So they should be informed about what they are choosing. As mature adults, we can't say that it is something that everybody would be aware about, like particularly about STIs or the pregnancy complications and all. It should be informed one that what way the activity is going to happen, and that should be informed and be aware to the consenting partners during this phase. And there is a something called uh, freely given, reversible, then informed and enthusiastic. So there is E is enthusiastic. So the person is voluntarily giving this option, and it is not something they are not feeling encouraged to, or they are in the dilemma of maybe, probably, let me try and see. So there should be enthusiastic participation. Okay, this is something I want to experience it, and let me see if that is something gives rise to the pleasure what I am trying to see. And there is S also related to this prize mnemonic. So freely given, reversible, informed, enthusiastic, and S is about specific. So it should be specific. That is really important, because many times we see that partners do consider that consent for one thing is consent as a blanket kind of a consent for everything. Like suppose the romantic partners, if they are coming close to each other, if trying to hug each other or get into a kiss, they consider that the sexual activity has started and it should end with some kind of intercourse at that moment. But it's not so. It is a specific thing. Maybe your partner would be interested in just exploring the foreplay or the kiss, but they are not comfortable or they don't want to indulge into the intercourse, and they can stop you from that moment that they don't want to go ahead. And that should come with assertiveness, firmness, and that should be respected equally by both partners. Okay, my partner is not willing right now, and I have to stop it here if my partner is not consenting for that. That kind of a equal kind of a understanding should develop between the partners, and this is equally important with the all because we see usually people do assume that it is a kind of a heterosexual experience we are talking about when we say about sexuality, but this equally applies to other communities also, like LGBTQI community, where this is important to know that where the consent is to be noted, and where this communication should have, that whether the person is having the similar inclination as I have, or he or she has the similar kind of orientation what I am having inside me, and that should also be understood. Yeah, yes,
Yes,
Elisa.
very rightly said from Devashri and Dr. Rahul. And the emphasis on how consent is not just a one-time thing, and it has to be given very explicitly, and it has to be ongoing. And the part where Dr. Rahul very clearly said that no itself is a complete statement, and that is how it should be respected. So, that is consent and communication are one of probably the most important things in a good relationship. And even in strong relationships, sometimes challenges can arise. So, when these challenges have a big impact on sexual health, what do you think are some of the common relationship hurdles that people face in this area?
Yes, so see, many times people take this no as something, a sense of rejection, or something like that they feel that they are not into this relationship. So these kind of assumptions start playing in the mind of a partner who was enthusiastically trying to involve. The other partner was not consenting for that moment. So see, the conflict can happen at any moment, but we are right now coming to this discussion. We need to understand that each individual has a right to experience the pleasure related to sexual intimacy based on their level of understanding, based on their ability to consent, and their own ability to explore the various activities involved into it. And it cannot be experienced through any kind of a relationship where there is a coercion or force or any kind of a non-consensual thing, and that every individual has that right to choose. Because what we try to consider that pleasure and consent, these are uh, two sides of a single coin. If you are wanting to have a kind of pleasurable experience, there would be a consent required from the involving partners. Then only it will be a pleasurable experience. And that is how the pleasure and consent, we say that they are two sides of the same coin. And if there is a non-consensual partner, there can be some difficulties because one partner may be arose or something they are expecting, experiencing that time. And here we need to emphasize that they can experience that sexual urge through masturbation or some other means if their partner is not consenting. And that is okay because we see that there are many myths related to masturbation also in our community. Maybe we can discuss it also in one part of our discussion. But for now, resolving this conflict where a kind of a compassionate attitude towards the partner, understanding what they are trying to say, and trying to understand that they have the right to choose what they want to do at the moment. And that doesn't signify whether you are less or whether your relationship at less any moment. Your relationship may be that much intimate emotionally, but at the same time, physical intimacy may not be there. And we have also seen that many times uh, there are certain pains which are happening around the intercourse, like some males, if they have some kind of a structure in their penis which is not allowing them to have a pain, not that is making them feel experience pain. Like suppose some kind of a foreskin is there and that is not allowing them to have a erection without pain, so they may not be able to sustain the erection and they will need some kind of assistance through surgeons so that they can experience this erection without pain. And the same way, sometimes we see that some females do have fear related to sexual intercourse, and that needs to be addressed to a sex therapist or a mental health professional where they can comfortably share what is making them feel this fear about. And that leads to a physiological response where the even though the foreplay is there and there may be sometimes consent also, but the pain takes them out from that consent because of that pain. And we medically call it dyspareunia, or in the simple terms, it is called vaginismus, where this pain deters them from actively engaging into the sexual activity due to fear of intercourse. And that needs special attention from the team of gynecologists, mental health professional, or sex therapists. And that is how this fear can be overcome, or the roots related to this fear can be dealt with. So this is how the conflict at the point of sexual activity we see, but the conflicts do occur on a day-to-day basis or a regular basis in relationship partners, and that they need to be equally addressed. Because what we also see that the sexual activity doesn't start at 9:30 in the bed, but it starts in the morning when you have the first good morning with your partner, or when you have the first fight with your partner in the morning, because that is going to stay in the head through both or one of the partners, and that will impact your sexual relationship also. So resolving those conflicts, maybe Devashri would be the better panelist. I would suggest that she can guide us about how the conflict resolution can be tried by various mechanisms from the partners to compassionate understanding, or how they can come to a common understanding which doesn't impact their sexual life irrespective of their conflicts or ongoing conflicts also. Yeah.
Yes, Dr. Rahul, I really appreciate you highlighting how sexual activity isn't something that just occurs at night. It's not a checklist activity, right? That shows how integral sexual activity, sexual health, just attitude towards sexual relationship, how important that is to cultivate, to nurture positive relationship with your partner. Um, so if I have to talk about the common challenges that people experience in their relationship, the often the conflict areas, I think one of the first things I'll take you from what you said also, that you spoken about is just having disagreements. If there are any underlying fights, underlying arguments, underlying disagreements, that definitely affect one's sexual desire, right? As you rightly mentioned, typically just because it's 9:30 p.m. doesn't necessarily mean that it's time to do an act of sorts. No, it's a very intimate personal process. It's very important to be for both the individuals to be consensual towards it. A common challenge that most couples experience, uh, during their just relationship is also just stress and anxiety. In general, in life, due to your occupation or due to any personal difficulty, if you're dealing with high levels of stress and high levels of anxiety, it does affect your sexual satisfaction. There can individuals can also have body image issues, right? Because as I said, sexual intimacy is highly personal. It's very, very private. So if one is dealing with body image issues, right, the causes can be varied. But if you're actively dealing with that issue, it can be very difficult for someone to get sexually intimate with someone, right? When we talk about sexual intimacy, an important component of that is also just emotional, intellectual intimacy. It's really important to feel very comfortable in one's own body, to have that self acceptance within oneself. Another challenge and or conflict that crosses my mind is, again, as I said, mismatched expectations. It's very important to take into account that you and your partner should be on the same page, right? It's completely possible that you like something, you like different things than your partner. It's important to be open about that. It's important to communicate that. It's important to have that very honest, loyal, open, respectful communication in order for those two people then to come on a common ground. That, you know what, I recognize and I respect that you might be you might like to sexually explore some things, but you know what, I am slightly uncomfortable when it comes to exploring new things sexually. So how do we go about this, right? What can we do? So it's very important to very honestly, very openly speak about these things, and therefore also respect the commonalities and respect differences as well. Another thing, again, that often can be a challenge in relationships is just dissatisfaction. If there are any underlying concerns, underlying grievances, underlying arguments that constantly simmer, it can then affect how you communicate with your partner. Yes.
Yeah, so many times people get into a cognitive dissonance that if I have a disagreement with my partner, then probably I don't have a feeling for that partner. I can't get intimate into the partner. But it is equally required to be understood that there are going to be some differences, and which we see that relationship counseling, almost 69 to 70% of the challenges in the relationship will never get resolved, and despite there can be a fulfilling relationship being uh, touched upon, and that would be mutually thriving for the both partners, and it is possible through communication and mutual respect, and that is what the basic need of any kind of a relationship. And differences can set some occasions apart, but the sexual intimacy is not something which will eventually all the time will be required. Like there are certain kind of expectations, as we discussed just now, like that every time the sexual encounter should be to that fulfilling level or that expectation level. So we need to understand that not every batsman can score a century on every match, and that is fine. That some occasions may be special, and that's how they become special, and some occasions will be just the normal. And sometimes matching the desires is also something what people struggle with, the couple struggle with. So some of the partners may have a high desire for a particular phase of their life, and some partners may not be having that high desire as compared to their partners, and they will have to use the techniques of masturbation or some other ways through the help of their sex therapists, so that they maintain on their desires. At the same time, they are getting into the intimate activity only when both the partners are consenting, and that doesn't disturb their well-being, because they are not able to fulfill the level of desire they are trying to have on their lives. Yeah. So this is about the sexual intimacy and the kind of a this communication with regard to that. But for relationships, definitely people need to understand that, because we see that many conflicts do occur. And Eliza, you may ask us what way we can help people to resolve those conflicts. Yeah.
Right, and I think part of what even Deoshri said, that having to, match your expectations and learning to negotiate and compromise. So, how can like couples, while, they understand a conflict, you have to resolve a conflict like this. How can they better find balance when it comes to, matching expectations or coming on the same page?
Mm. So this is a very complex question. What I see, Lisa, maybe this will need some therapy
What?
sessions, 5, 7, or 8 sessions. I can't comment on this, but it is a very complex question, and it is important for audiences to know. But if they are experiencing this, better they reach out to respective professionals, because people also have a confusion that whom to reach for what. Like there is no clarity like who is the actual sexologist or sex related person. So if there are infections, you need to reach to gynecologist for females, or the infectious disease specialist, or the venerologist, or which are the skin specialist doctor in our setting. So that is something related to infection. If you are facing issues related to sexual performance, say there are issues related to erection or ejaculation or intimacy, it is better to reach out to sex therapist, psychiatrist, or mental health professional working into the sexual health, because it is a psychosexual aspect of their disturbance. And that is how people need to understand if there is a structural defect, something like it is not allowing them to experience their sexual pleasure, then a surgeon may be more appropriate to check whether the organs are in a good shape for that. Because many people have doubts related to, see, various doubts and myths are there, starting from the size, the appearance, deviation, and all these doubts are there. But we need to understand that as the fingers or your body organs are on a variance, the same applies to your genitals, and it can be on a slightly different from what you have seen on some kind of a material or what you have read about it, and it is fine. It is your body organ, and you should be able to understand that this is something I am having it the way it is, and I am accepting it the way it is. Because as we see that the body shame, and this also induces some kind of a guilt which prevents people from actively, enthusiastically indulging into the intimate relations. Yeah. Yes, Elise.
So I think this is one of the things that I have noticed in my, practice as a counselor, that sometimes there can be a lot of guilt and shame that comes when people self-pleasure. There's already so much taboo related to that. So, when they come with so much guilt and shame, how can one person go about something like, when they're struggling with such kind of feelings?
Yeah. So, especially related to masturbation that we discussed previously. So there are certain philosophies related to masturbation, but the surveys are clear that almost 80% of men and 60 to 70% of women have been uh, told that during the survey that they have been practicing masturbation, and it is not related to any loss of any kind of a health, or not related to any. So there are so many misconceptions that it will give rise to spectacles, it will give rise to something impotence, it will give rise to some loss of blood and all. These are all misconceptions related to the loss of semen or the sexual activity. But once it is done privately for the sense of getting pleasure, and it is something as okay with their own requirements. It is not something a compulsive act. They are doing it irrespective of whether they are actually wanting to have it or not. It is healthy to have masturbation as a part of the sexual experiences. So we see that many times people feel that once there is a kind of a intimate partner, there is no need of masturbation also. But this is also a myth that we see that many times people can switch from masturbation to the sexual intimacy based on their own partner availability and all. So there is nothing to be shameful if they are indulging into masturbation, despite if they are into a committed relationship or so. So that is something people need to demyth these things. I think we have a poll on that also. So is it the time for the poll, Elisa, or it's afterwards?
Yes. SIU team, can we run the
Yeah,
poll?
poll two, maybe we can have it now. Yeah, so does the practice of masturbation give rise to loss of vigor, or it leads to impotence? and that is the question. Answer options are yes, no, maybe, and we want our audiences to please take a look. You might be busy in some work, we understand, but take a look and try to submit as many participants are there. Has everybody able to submit the poll? SCEW team, can we know how many responses we have received so far?
We received 3 responses. Out of 3, we got no for all 3.
Okay, thank you for sharing this details and thank you for uh, submitting this poll. So that's what recently we discussed, and that's true that masturbation is a healthy practice till the point it is done privately with the goal of self-pleasure, and it is not something which is compensating or being a compulsive act due to any reasons. Yeah.
Sir, if that's okay, I'd like to just add one more thing.
Yeah.
Alisa, you asked guilt and shame, right, are
Hmm.
associated with masturbation. So this is again, as Sir said, is a very difficult question to answer because we can't tackle this issue using a one size fits all approach, right? Often, individuals who grow into adults, often you receive messages around you as children surrounding masturbation, right? So surrounding touching oneself. There are lots of messages, can be through friends, family, peers, movies, music. So we, as children, start developing these ideas around sexuality and self pleasure. So therefore, it can really be very difficult as adults to acknowledge one's own sexual desires and therefore engage in sexual activities. Again, as I said, in order to tackle guilt and shame surrounding self pleasure, it's first of all important to understand where is it coming from. And as Sir rightly mentioned, it's highly recommended that you speak to a specialist about this, perhaps a psychologist or psychiatrist who is trained and qualified to understand problems of such nature. So that one is able to engage in sexual pleasure because, as Sir mentioned, it's completely healthy, very common, and there's nothing wrong with it. Yes, Alyssa.
Right. Thank you so much, Deoshri. That I think puts another perspective on, the guilt and shame and where it comes from. So also when we talk about sexual health, another sensitive topic and that's very crucial to sexual health would be the STI, STIs in general. So, a person's STI status or, sharing it with a partner or just, how it's transmitted. These are all very important things to discuss. So, Dr. Rahul, would you want to
Yeah,
come?
so sexually transmitted infections are quite prevalent in any communities. If you see the data, almost 1 million people, that is almost 10 million people, get some or other form of sexual transmitted infections, which some may be mild also, but it is we should be aware that almost 10 million is the 1 million, the 10 lakh is the people in over the globe who are encountering any kind of a sexually transmitted infection. We need to be aware about a few things that the sexual fluids and like semen and the blood and blood related products which can carry certain infections and viruses or the epithelial lining of the sexual or mucosal lines, we call it in medical terms. So wherever there is a thin lining, it is more likely that the infection staying on that uh, thin lining will get transferred to someone else because it has thin lining has a very less kind of a skin. So skin to skin barrier is usually what prevents us from getting kind of infection. But wherever there is a thin lining related to any organs like oral mucosa or vaginal mucosa, the chances of the infective pathogen getting into our body system becomes high, and that is how the infections occur. And it is our right to check with our partner whether they are having any sexually transmitted infection, and that's why is important if you are indulging into any kind of act where you are not sure that this person status, please ask them rightly, and still even if they say no, please try to use the barrier contraception in the form of a condom. And we would like to highlight here that the condoms are available in male as well as a female condoms. So it is not something, if your partner, suppose a male partner is not having condom, you can still have your own condom as a female partner, and you can use that rightly. There are videos on YouTube. You can see that how to apply and how to use them, because using them through right technique is also important. Because if it is not used rightly, there can be chances of uh, uh, breaking the mucosal lining with the fluids, or some kind of blood cuts and all. So there is a need to get aware about these things before people get into any kind of sexual maturation. And these things need to be mentioned to all the people who are going to cross their 18, because we see the age of sexual intimacy is decreasing. There are various concerns related to that any person who is below 18, they by legally in India they cannot consent for any kind of a sexual act, but still they should be aware about what is it. Just because if they cross 18, they should be aware about what way they are informed about their sexual partners and the infections, and how they can be informed about preventing it. And we do recommend that below 18, there should not be any form of kind of a sexual intimacy or activity, because that is not according to the systems in legal systems in India. And we though we encourage that people below 18 may try to have masturbation as their practice if they are getting into the adolescent and they are experiencing those urges, it is fine that they can get into the masturbation, but no form of sexual activity till the 18 years of age for sure. And in case the sexually transmitted infections do occur, there may be rash, there may be some kind of itching, or there may be some kind of a fever and this experience, or some kind of a discoloration on the mucosa, which needs to be consulted to a physician, or infectious disease specialist, or a dermatologist or venerologist, which are the skin specialist doctor, but this is impacting their skin, and through skin the infection is catching. So the best strategy is use barrier contraception. And many times people, we have seen that they are using contraception through some oral contraceptives or emergency pills. But it is necessary to know they are only going to prevent the pregnancies. They are not going to work on sexually transmitted infections. So for sexually transmitted infections, the barrier contraception, that is condoms, are the only measures which can prevent anyone from sexually transmitted infections. And please note that this is what is required. And you might be seeing some ads and all related to the condoms also. So there are myths related to condoms also, like this may reduce my sexual experience, or it may not give rise to the similar kind of a pleasure. But these are mostly the myths, and we suggest our audiences that if they keep these myths aside, the activity may be equally enjoyable if they want to prioritize their safety. And there is nothing more important than safety. They want to risk themselves through any means. Yeah.
So following from that, we also have a poll related to STI. So can the SIU team put that up?
Yeah. Poll 3, if we can have. What should be done in case someone opts for unprotected consensual sexual intercourse with an unknown partner? Like the partner is not known, the status is not known, and they feel like to consent for that act by some reasons on that particular moment, and they continue with that, but they don't use the barrier contraception. What should be done? Because it is unprotected, what it means. They should forget it, like they should not give it a thought, or they should take emergency contraceptive pill immediately to just avoid just pregnancy in that case, or they should consult nearby gynecologists or venerologists or infectious disease specialists, or they can't do anything, like it is done now that they can't do anything. So we want to highlight that in the right time, if they reach to appropriate professionals, it is going to be saving their lives. And many times various treatment measures are available, provided they reach within time, irrespective of stigma, taboo, or guilt, because it is something in right time. If they reach to the medical professionals, they can help them through proper treatment protocols. So there should not be any shame. But as far as possible, working on these principles to choose barrier contraception is what we, as a health professionals, do recommend, because that is preventing their risk into any situation. Yeah. If the polls have been submitted, we can know. SCEW team, have we got the responses?
So we got three responses. All three are goes to third option.
Okay. So they should reach to professionals, the what we eventually were trying to discuss, that reaching out to professional is important, and avoiding such situations occurring is the main kind of a thing that people can work on, so that they don't get into any kind of a risky, complicated situation. So yeah, yes. Anything has been left for any questions? If we have, maybe we can take that also, Elisa and Devashri.
Yes. So, is just that so much we've been emphasizing so much on communication and having these things, but sometimes a relationship can turn into toxic or even abusive territory, and it's also important for us to understand what what may be the signs. So, what could be the red flags or something that we should watch out for.
Um,
Yes, Devashri.
Again, a very important question, Elisa. So now when we talk about warning signs, it's important to note that these warning signs or the signs of a toxic, unhealthy relationships can be verbal and non-verbal both, right? If there is lack of communication between you and your partner, if they are providing you silent treatment, that is one of the signs. If there are too many anger outbursts, that can be one sign that that maybe your relationship needs some other things need to be addressed in your relationship, perhaps. Apart from that, lack of trust is again a very common relationship challenge. Then there is also jealousy and verbal and physical abuse. um,
Yeah, so no form of abuse can make an individual experience a fulfilling, mutually respectful relationship. So abuse is a big no for any, like, physical, emotional, psychological abuse. So it is a big no for any kind of a relationship, and if it is that form of relationship, then it is probably a toxic one. If it is not giving you a sense of kind of a mutual pleasure, safety, and something being heard, understood, then it is a simple thing that if it is not being giving you these emotions, then it is a kind of a toxic relationship. Either you are getting controlled, dominated by the partner, or they are treating you as a part of them and not allowing your own full expression. They may be disrespectful at times, or they may feel jealous, or some kind of a tantrums, drama in the emotions are frequently. Then it is something kind of a toxic relationship we see. And the safety needs are of prime important. And for that reason, we suggest that setting your boundaries and being clear about it, and being acknowledging it very openly, that okay, this is something my partner doesn't want and I have to follow with that. That is a clear kind of a communication we need to have. Seeking support from necessary people whenever there are challenges, or taking a time break sometimes if people are feeling that this is something not working well, allowing your partner to reflect and understand what way your relationship has to be. That is something we do encourage people when they are going through emotional turmoils. And learning the effective communication styles is something you can keep on your bucket list when you are getting into a relationship, because that is the only thing that will improve the chances of a relationship being more kind of a mutually and fulfilling for each of the partners involved. And knowing when to let go, which things to hold on. This is something, a skill that people need to learn.
Yes, sir. I think another red flag to add is also if somebody is trying to convince you too much. As I said, clear consent, it's very obvious, it's very clear, it's not very confusing. However, if one needs time to figure out what if they really want to explore some area, and still if your partner tries to convince you, if they say, okay, I get it, but then they still come back and try to convince you, try to manipulate you in any regard, that is definitely a very clear red sign, and it shows that their words are not matching their actions. So that should definitely be taken into account.
Particularly gaslighting is what we see in some kind of
Yes.
relationship, where the partner is made to believe on something which may not be part of their actions or beliefs, and that starts questioning themselves whether I am sane or whether I am actually doing the same. And these kind of self doubts do create some issues related to self esteem of the partner, and this is done consciously, and that is how the relationship is going to experience certain turmoils. So it needs a whole new understanding when the relationships are formed, especially the romantic ones. And that may be another point of our webinar. Sometimes we'll touch upon. Right now, we are just discussing what are the positive aspects of a relationship, but how to cultivate them and how to grow them is a skill. And it will only be learned through various kind of sessions that we are here through Symbiosis Center for Emotional Wellbeing to keep on and having you aware and informed about those skills. Yeah.
Right. As you mentioned that, it's very important to protect ourselves in these relationships. So when we talk about ourselves, the self also plays a very big role in any sexual relationship. So, our self-esteem and our body image plays a role on how we approach these relationships also. So, what do you think could be a ways where we can boost our self-esteem or just feel more comfortable with ourselves?
Yeah, so many times we see that people who struggle on the relationship, they will keep on struggling, and there may be multiple relationships also formed. Like first relationship, they had some bad experience, and they will be rebounding to someone else with that trauma, or maybe they will take a break, but again they will try to find out the similar pattern relationships, and that keeps on going until they heal themselves or learn through these attachment styles, and that eventually leads to what form of relationship they have with themselves. Like, how do I treat myself? How do I consider myself? What kind of a beliefs I have in myself about me? And those are going to determine what kind of a partner they are trying to go to attract. So this is a common thing we see, that people want to have a great partner, but they don't want to work on themselves. And this totally disrupts this natural selection process, what we see. So if you can work on yourself, you're bound to get a partner which matches the needs and the requirements that you are trying to signal out. That is not a all the times line. I don't want to mention that things may go wrong in relationship, but it is mostly what we see on a usual pattern when we see the relationship patterns in the communities or societies. So working on yourself is the key important factor. If you want to have positive relationship, you need to bring those values inside you, and that will get reflected through your thoughts, emotions, and behavior. And that is something we want to highlight. If there are certain areas which you are not able to work on, mental health professionals, counselors are there who can help you to identify them, to work on them, and to correct them if they are not something you want to continue. But realization is something is that needs to happen. If something is not being realized that this is going to make me into difficult situations in regard to relationship with any community members, it is better to recognize it and work on it, and that is what we encourage as mental health professionals.
Right, right. So being authentic to
I think we are not able to hear you, Eliza. So being authentic and something you were trying to say, yeah.
Yeah, I think I lost my connection. Just being authentic towards yourself and living with your, alignment of your values. So,
Yeah. So this is important to have a relationship
Now,
with
and
your
I
own
also
self.
wanted to let
Yes, Elise,
I
please
also
go.
wanted to let our audiences know that Devashri would be stepping out. Thank you so much for joining us today, Devashri. It has been wonderful having you here.
Yeah, thank you, Devashri. And yeah, if there are any doubts or questions, maybe we can take them for now. Okay.
Yes. Thank you so much, Elisa. Thank you, sir. I will see you around. Bye bye.
So, Elisa, are there any questions we should be taking? You can check with our team on YouTube also.
Yeah. SIU team, could we run the last poll and we'll also check for questions. If anybody
Yeah.
has any questions, they can type it in the chat box here. And also on YouTube, if anyone has questions, they can type it in their chat box.
Okay, so the last question for this webinar, can a relationship partner consenting for a foreplay can refuse for the intercourse or coitus? No, they can't take their words back. Sometimes they can do so. They can refuse at any point, or they should not consent for foreplay also if they don't want to be part in the intercourse. This is the question, and we want to see what our audiences take from this scenario. We already discussed about consent. Maybe if we are ready with the responses, SIU IT team, can we get what responses did we get?
Yes, sir. We have two responses, and all two are went to third options.
Third option, right? So they can take their consent any moment back, and it is their right to do so. There is nothing shame, nothing guilt, or nothing harm in doing so. Or there needs equal kind of a reciprocation from the partner that this is not something my partner is willing to go ahead, and that activity cannot go ahead, right? Yes, Elise. I think we have tried to touch upon various aspects related to relationship, the positive emotions, and the sexual aspects, psychosexual aspects particularly. And if there are any questions, we can see that, or we can conclude, I think.
Right. We don't have any questions from YouTube or from chat here. So we will wrap up now. So as we wrap up today's webinar, I want to thank everyone for engaging in this important conversation. Since we've covered a range of topics today, from communication to emotional intimacy, consent, STI awareness, as well as so, a big takeaway for us would be maintaining sexual health isn't just physical well-being, but also about fostering respectful, open, and supportive relationships. I hope you all leave today feeling empowered with knowledge and ready to continue these conversations with the people in your own lives as well. So remember, it's important to remember that sexual health is an ongoing journey and prioritizing it is a key to our overall well-being. Thank you so much for being part of this session. Thank
Yes, thank you, Elisa, for hosting this webinar.
that we have
And
started.
yeah,
Thank you.
thank you, SIU IT team, for kindly arranging for this webinar and the reschedule. Thank you so
Thank
much.
you.
Yeah.